Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the great Saphenous vein. The great Saphenous vein is also called large Saphenous vein. The great Saphenous vein is the longest vein in our body. So first of all, we'll go to the formation of the great Saphenous vein. Okay, it is formed by the union of the medial end of the dorsal venous arch of the foot and the medial marginal vein on the dorsum of the foot. Okay, we got the formation formed by the union of the medial end of the dorsal venous arch and the medial marginal vein. Okay, now we go to the course of the great Saphenous vein. Course. Okay, it passes in front of the medial medullas. Passes in front of the medial medullas. Okay, so again, if you go to the formation, this is the dorsal venous arch and this is the medial marginal vein, and this is the great Saphenous vein formation. Great Saphenous vein formation here. When it passes in front of the medial medullas, this is medial medullas of the tibia. Okay, so if you go here, this is the medial medullas. It passes in front of the medial medullas of the tibia. Okay, and ascends along the medial surface of the tibia and then the medial margin of the tibia Okay, we got that. Okay, then passes behind the medial aspect of the knee and then ascends on the anterior aspect of the thigh, anterior aspect of the thigh to the saphenous opening, saphenous opening of the fascia lata, opening in the fascia lata. Okay, and passes through the cribriform fascia, that is covering the gap in the fascia lata, in the saphenous opening, cribriform fascia, and opens into the femoral vein. So, great saphenous vein is a tributary of the femoral vein. It is a tributary of the femoral vein. We got the course from the formation, medial part of dorsal venous network, dorsal venous arch. This is the medial marginal vein, formation of Stephanos vein. It passes in front of the medial medullas of the tibia, goes along the medial surface of the tibia, then in the upper two-thirds of the leg, it passes along the medial border of the tibia, going to the posterior aspect of the knee joint, then again go in front of the anterior aspect of the thigh, and opens into the saphenous opening. This is the saphenous opening, and it opens into the femoral vein. So the great saphenous vein opens into the femoral vein. So if this is the femoral vein, then the great saphenous vein opens into here. This is femoral vein. This is the great saphenous vein. Great saphenous vein. Okay, we got the course. Then we have to know the vein. This vein has nearly 10 to 20 valves. Okay, so idea is that valve will pass the blood, go up. So the direction of the valve is like that. Okay, if we draw here, valve is like that. So blood will go there, blood may not go down. This is one way. Okay, so it has 10 to 20 valve. One valve inside the saphenous opening, where it enters into the femoral vein. Another valve at the beginning of the saphenous opening. Okay, other valves are present, so around 10 to 20 valves. Valve will flow the blood in one direction. Okay, not going back. Okay, so 10 to 20 valves. The saphenous vein also connected to the deep veins through the perforating veins. The saphenous, the great saphenous vein is also connected to the deep veins by the perforating veins. Okay, deep vein means the femoral vein, the posterior tibial vein. These are the deep vein. So the great saphenous vein is connected to the deep vein by means of the perforating vein, and perforating vein has valves also. Perforating veins has valves. Okay, so valve is there. So blood from the superficial aspect, from the superficial vein, should go through the perforating vein that goes through the muscle to the deep vein. Okay, we got the valves and connection of the, and the great saphenous vein is connected to the small saphenous vein. Okay, so to know that part, now we must know the tributaries of the great saphenous vein. Tributaries. So the formative tributaries in the foot, we have two formative tributaries. One is the medial end of the, you can say, dorsal venous arch, and the medial marginal vein of the foot, marginal vein. Okay, we got that in the foot. So we have the tributaries in the leg. We have in the leg, we have the anterior vein of the leg. Okay, anterior vein of the leg. We have the anterior vein of the leg, anterior cutaneous vein, we can say, anterior cutaneous vein of the leg. We have also the posterior arch vein. Okay, anterior cutaneous vein of the leg, or anterior vein of the leg, and also posterior arch vein. Posterior arch vein. Okay, so this is the anterior cutaneous vein. Okay, or anterior vein of the leg, and this is here anterior cutaneous vein is this, and with the posterior arch vein is this. Posterior arch vein. Posterior arch vein is formed by a series of small venous arches that connects the medial ankle perforators, and they join to the great saphenous vein near the knee joint here. This is the vein, and it opens into the great saphenous vein near the knee joint. The posterior arch vein, so anterior cutaneous vein of the leg. Okay, and the posterior arch vein. We got that. Now we'll go to the tributaries in the thigh. Okay. Tributaries in the thigh. In the thigh, we have one anterolateral tributary. Okay, that is called anterior cutaneous vein of the thigh. Anterior cutaneous vein of the thigh. Okay, We have also another tributary, that is posteromedial tributary, okay, that is also called accessory saphenous vein, accessory saphenous vein, okay, that is going posteromedially, and it may connect with that of the small saphenous vein. We have also some connecting vein between the multiple, more than one, maybe one or more than one connecting vein between the great saphenous vein and the small saphenous vein. Okay, you can write this here. Okay. Okay, so that is present mostly, the connecting vein is mostly present in the leg area, not in the thigh area. Thigh area we have the accessory saphenous vein that is going to, that may be connected with that of the small saphenous vein. Okay, now we'll go to the tributaries of the tributaries in the thigh, okay, at the saphenous opening, okay, saphenous opening, okay. So just before it opens into the, okay, tributaries in the thigh, just before the saphenous opening, we have multiple vein like that. We have the vein, superficial circumflex iliac vein, superficial, so this is 1, this is 2, this is 3, this is 4, superficial circumflex iliac vein, okay, then superficial epigastric vein, another one is the superficial external pudendal vein, okay. We got 3 tributaries just before. This is the superficial circumflex iliac, this is the superficial epigastric here, this is the superficial external pudendal. These are just before the great, this is the great saphenous vein, before it opens into the saphenous opening. We have 3 tributaries. We have tributaries in the saphenous opening, just before the great saphenous vein opens into the femoral vein, okay. So we have another tributary, that is deep external pudendal vein, okay. We got that. We have also a lot of other unnamed veins, okay. We got the tributaries, formation, course of the great saphenous vein. So now we learn the clinical anatomy. This is very important to us. Clinical anatomy. Okay. First of all, we give emphasis on the varicose vein. Okay. Then we have to go to the veiny section and we have to discuss the grafting, coronary artery bypass grafting. Okay, so the varicose vein is a condition when the great saphenous vein is dilated, usually close to the to the valve area. So it may be dilated like that way, dilated, multiple tributaries also go there, okay, like that, maybe dilated like this, okay. So it is called varicosity. This happens due to incompetent valve, valve in the great saphenous vein plus valve in the perforating vein, either way or both, okay. So incompetent valves may cause varicosity in the vein, okay, and also it may be a consequence of pregnancy, okay. During pregnancy, the region behind that, the fetal head may obstruct the flow of the venous blood from the lower limb to the pelvis when the fetal head is going to the pelvic brim, okay. Also there are some hormonal changes. Also it may be genetic. Someone's valve system is weak from the very beginning of their life. It may be genetic, okay. Or it may be varicosity may be related to some type of occupation, okay. So there are many reasons for varicosity. Usually the surgeon, what they do, they can repair the varicosity, may take out the part of the great saphenous vein, it is called ablation, or they may reconstruct the valve, okay. So we got that. Venesection is very important. Here it is done over the anterior medullas area, okay. So venesection is important venesection, just it is done close to the or in front of the medial medullas, okay. So idea is that when venesection is done, the saphenous nerve should be protected because we have accompaniment of the great saphenous vein with that of the saphenous nerve, okay. So there is a nerve here that follow the great saphenous vein up to the knee. This is the saphenous nerve, okay. Saphenous nerve, that is a branch of the femoral nerve. So there is an accompaniment to the great saphenous vein and also accompaniment here. So idea is that vein, when the venesection is done, the nerve should be protected, it should not be damaged. And there is the type of ligature is given, that ligature should not involve the nerve, okay. We got that. So venesection is important to us to give the blood or fluid or antibiotic very quickly or medication. Then coronary artery bypass grafting, coronary artery bypass grafting, okay. This is done when the heart artery, especially the left coronary artery or the right coronary artery, is blocked, okay. Then a piece of the saphenous vein is taken out and it should connect the distal part of the block to the arch of the aorta here, to the arch of the aorta is connected, okay, by the great saphenous vein, okay. That is the idea, coronary artery bypass grafting, okay. So usually the arch of the aorta is connected to the distal part of the, or it may be the connection between the proximal part and distal part of the block anywhere. So this is the way to bypass the blockage, okay. So that is very common practice, from aorta to the distal part or surrounding big blood vessel, or even the same coronary artery, one part to another part, just bypassing the block. That is called coronary artery bypass grafting, okay. So That's all about the great Stephanos vein. If you like my video, please support my channel. Please subscribe me. If you have any question, please feel free to ask me and share the information with your friends. Have a nice day. Bye.